Life sometimes come at you fast. Tragedies make your life unravel. You feel like you wanna give up and stay knocked down. Even when your heart is shattered, you still got a life to live. You still got a life to live, so don't give up. We are beautiful miracles. We are beautiful miracles. We are beautiful miracles, so don't give up.
Hello, everybody, and thank you for joining me again on my podcast, Beautiful Tragedy. And if you like what you're hearing, would you please like, comment, share, and subscribe? In today's episode, I'm going to be sharing just some little bits about how grief affects your brain, as well as some self-care tips that have worked for me. I will always make sure to mention that I am not a professional. I'm just a mom who's lived through child loss, and I'm trying to take what I've learned and share it with other people in hopes that maybe it can help someone else. I think everyone who's lost a child, obviously that's my focus is child loss, but any kind of loss applies to the things that I'm saying. You know, nothing fixes it, but, being aware of actually how grief can affect your brain, it can help us to understand it, and it can help us to take better care of ourselves if we know that actually it can change your biochemistry. Child loss is a marathon, not a sprint, and it's something that we have to live with for the rest of our lives. And, when you can understand what it has done to us and how we can take care of ourselves, it can really help us through this journey. Megan Devine, who is an expert in the field of grief and loss, said in her book, "It's Okay That You're Not Okay." We often think that grief is primarily emotional, but grief is a full body, full mind experience. It can change your biochemistry. It can cause changes to your appetite, digestion, sleep, breathing, heart rate, and blood pressure. It can cause confusion, memory loss, short attention span, and those changes can last for years, and that is perfectly normal. After Jackson died, we were gifted so many books, and I would sit down and read a book, and I couldn't read longer than one page. And I've never had ADD or ADHD to any degree, but in the early stages of grief, I couldn't focus on anything for much longer than a minute. Grief is just so exhausting physically and mentally. It can cause insomnia or the need to sleep almost constantly. And, sleep helps to heal your body and it restores itself. So if that's what you need, then, try to listen to your body. For me, I don't know why I've been, fortunate, I guess, that I don't have any trouble sleeping. I'm so exhausted by the end of the day that I just crash. I am cursed with waking up very early every day. So one of the things that I've done that has helped me in my journey is exercise. Our therapist has shared with us that exercise is like taking a 10 milligram Zoloft. And, when you're exercising, it's releasing hormones in your body that help to, make you happier, I guess. And so I've really taken that advice to heart, and working out for me is just as much for my mind as it is for my body. Grief can really physically change your body. Personally, since I had two major occurrences happen in such a short amount of time, I delivered a surrogate baby, and 6 days later, Jackson went into the hospital, and then 6 days after that, he died. So within 12 days, I gave birth to someone else's child and lost my own child. And despite the fact that I have been working out 4 days a week, I literally have stayed the exact same weight. My body is almost like frozen, I think, from the trauma that I endured. In early grief, people can, often have mysterious pains and stomach aches, headaches, dizziness. And this doesn't necessarily mean that something else might be wrong, but it's also very common side effects during early grief. Anytime a death is unexpected, traumatic, or out of order, it causes stress. And a child's death is very much out of the natural order of things. So the Richter scale of stress that a child loss causes is not even on the list. I just recently saw a scale talking about like the level of stress. So like the death of a spouse was 100, and divorce and changing a job, moving, just kind of major life events like that. Losing a child is not even on the list. And I believe that's because it's a number that cannot even be registered with the level of stress. My husband, his immunity was down so much due to his grief that he had a blood infection and ended up needing open heart surgery. And it caused him, to be weak and anemic and tired, unable to work. The doctors thought that he had cancer. They were doing all these tests, and they couldn't figure out what was going on. Well, in time, luckily before he died, we intervened with hospital care and found out that he needed open heart surgery to repair his heart. And we fully believe that the stress that his body underwent with losing Jackson caused his heart to break, really. So, it was only less than 2 years after Jackson died that happened. So, obviously grief can take a huge toll on your body. I realize it's very difficult to prioritize self-care when your life has been turned upside down by the death of your loved one. In my case, it was my son. But things like eating healthy are helpful. I will admit I have been eating out of obligation. I most of the time just put food on the table because it's what needs to be done, even though I know it would be better for me if I was eating healthy and taking better care of myself in that way. When you take care of your body, it can really change your experience with grief. And doing things for yourself, trying to reduce your suffering if you can, it really is a gift to yourself. One of the things that I do personally is I treat myself to coffee. And anyone who knows me knows how much I love my coffee. And I don't drink alcohol. And so it's just something for me. It's just a little treat. It's something I look forward to. Everybody kind of has their little thing that they enjoy. And that's something that I really enjoy. Self-care can mean getting your hair done, getting a massage, taking a bubble bath. But it doesn't always have to mean that. It can mean, kind of doing some internal work, tending to your grief. One of the things that I've experienced is that if I don't tend to my grief, it tends to come and clobber me. And so I really have to learn to, just prepare myself for things that might be coming, or, just take time to look at pictures and just experience those hard feelings, because when I run away from them, I feel like they kind of come and take me down. I get caught a lot trying to stay busy in order to not totally deal with my feelings. Our therapist suggests sometimes that I go 80 miles an hour instead of 40. And the truth of the matter is, I don't like going 40 because it hurts too bad. And I'm very intentional and, in staying busy because it it's too painful. So, we also attend a monthly support group. Talking to other parents who've lost children can be very helpful. There's really no one who understands better than another bereaved parent. We are all a part of a club that no one wants to be a part of, but when you can hear from other parents, maybe that are further along in their journey, it can, be somewhat of an encouragement. Sometimes it can be, I don't know, disheartening in a way, because you might see someone who it's been 7 years since they lost their child and they're still, really having a hard time. So it's kind of a mixed bag, but for me, it's really just knowing that you're not alone, and going to therapy and support group is a huge part of our self-care. And my husband personally likes to go hiking because that's kind of a way that he, connects to Jackson and to nature. And it's really just kind of a grounding thing for him. And, everyone has different ways that they do self-care. And I just know that if I have to be all that I have to be to everyone in my family, I know that I have to take care of myself. And, I just want to encourage anyone to, to survive the nightmare of child loss. It's really important to take care of yourself and prioritize yourself. Our brains have been traumatized from this loss. And, it's been over 2 years. My brain still can't quite function to the level that it used to be able to, and maybe it never will. I mean, sometimes learning new things is hard. And I think I talked about it in the last episode that, I can tell that there's almost like some, I don't know if it's brain damage, but there's effects from the trauma. I really get overstimulated very easily. And so just kind of trying to, acknowledge that. And, part of my self-care is also learning how to have healthy boundaries with other people. My energy is just so tapped out every day. And so I really have a hard time with certain people's energy. And, it's nothing offensive. It's just that I'm trying to do everything I can to get through my days. And so having those boundaries is something that is really important for me. And I hope that, talking about self-care and realizing how important it is that, maybe people will share kind of things that they do, because maybe what you share could really help somebody else. And as I close this episode with my same quote, maybe I'll come up with another one at another point, but it's important for, I think, us to all remember that we're all trying to figure this out. I don't think any of us know how to do it. None of us have it figured out, whether it's life or loss or grief. Life is hard right now for people, and people that are grieving, it's especially hard. So, we're all just walking each other home. So I hope that, you guys are enjoying what I'm sharing, even though it's a hard subject. I hope that I've said something to encourage you along the way. And I would love to hear from people if you guys have any comments or things that you would like to talk about. If you would like to join me on the podcast, just let me know. So thank you for joining us today.